All right, welcome to the Mint Condition Podcast. My name is Brad Klemetson, your host. Today's going to be a unique episode. We've got some questions we're going to go through and kind of break things down about our company and why we do what we do, and hopefully give you some more insight into physical therapy and the way that PTs think. Today we've got Brody helping us out. He's going to be reading off some questions, and we're going to just go right down those. If you guys have any other questions you'd like to get answers to, share those in the comment section down below, whether you're on YouTube or listening on our podcast. All right, Brody, what do we got?
Sweet. So before Mint even existed, what problem in physical therapy frustrated you probably the most?
Oh, that's a good question. You had to start with the big one, huh? So with physical therapy, I'd say the biggest thing that frustrated me was insurance. Health insurance was extremely frustrating. You're always asking permission to do what you do best as a physical therapist. MDs deal with the same thing. Where the insurance is deciding what care you need. And we're doing our best to justify it or show them why our decision was right. But I've talked with a lot of people who worked for insurance companies, and they said that they're told to deny a certain percentage of claims, 17, 23%. I've heard different numbers. Just deny it. And they're hoping that you as a patient or your provider is too lazy or maybe didn't care enough to resubmit and try again. And that's quite frustrating. I also felt like I was treating the insurance. What did the insurance want to see? Well, they wanted to see this number of visits, or they wanted to see visits that lasted this long instead of giving what my patients needed.
Was there a moment where you realized PT doesn't have to be that way?
That's a good question. I always knew it didn't need to be that way, but I think it took a couple years for me to recognize that there were other routes, other methods, right? A lot of the chiropractors that I've worked with, they have a lot of cash paying patients. Seeing that that was an option. I started specializing in headaches and migraines, and I was able to see a lot of success with people. So I started getting a name for myself and my patients telling other patients. And so a lot of people would come see me and pay out of pocket to get better care. And when you're paying out of pocket, I could be with them one-on-one and help get them better faster. Not the best answer on that one, but that's what I got for you.
Who was the exact type of person you had in mind when you imagined first starting up Mint?
So I had already started, when I started doing this type of stuff, I was working full-time with a home health agency and treating a couple people on throughout the week. And all of them were people with headaches and migraines. And so I was looking for people, headaches, migraines, stress, tension in their neck and shoulders, and anybody that fell under that category. But it wasn't called Mint yet. And we were called, it wasn't really called anything, but we were trying to pick a name for it, and my patients were saying I should just call it Dr. Brad Physical Therapy. And then I had one very smart patient say, if you ever grow, you're going to not want to call it Dr. Brad Physical Therapy. And I was driving around looking for names, and Walmart Physical Therapy or DI Physical Therapy, whatever name, any company I passed, and I saw Mint Construction. And then I went Mint Physical Therapy, thought that was perfect. And I went home and broke it down. I was like, Mint has to stand for something. And after some time, we came up with Move, Improve, Nurture, Teach.
Love it. For someone hearing about Mint for the first time, how would you explain what makes it different from traditional PT companies?
So Mint Physical Therapy is different. Well, you get a whole wide range. You get physical therapists who have to see 8 patients per hour. They've got several techs working with them. Those techs are somewhat trained, maybe not trained at all, and the techs are often having to help patients work on exercises, and that's not great. And then all the way down to maybe IHC, where they get to be more one-on-one. And between that variety, you're going to get different quality of care. And even with some groups that do only 2 or 3 patients per hour, the therapists are sometimes burned out or sometimes less invested, so they're going to give you cookie cutter. And so the main difference you'll see with Mint Physical Therapy is Nobody gets cookie cutter care. Everybody gets something customized for you, and our whole plan is to get you better as fast as possible. Talk to any of our patients that we work with. We're not trying to drag it out. We're not trying to get you to come twice a week for forever. We actually want to get you down to once a week, once every other week, and help you get where you don't need us at all.
What should you look for when you're trying to go to a high quality physical therapy clinic?
This
You're looking
is
for the right place.
Yeah, this is my favorite question. If you're going to see a physical therapist or anybody who's working in this realm, massage therapists, chiropractors, anybody working with physical medicine, they need to do a couple things. First off, you got to have a thorough assessment. Thorough assessment means hands-on. A lot of people I've talked to say that their physical therapist doesn't even touch them at all. And they need to be feeling the tissues, moving the joint, watching you move. And if they're not seeing those things and interacting with you that way, then the assessment's not very good. They also need to be assessing what is the injury, not the symptom. Let's treat the root cause that fixes you and gets you better so that you don't have to just keep coming back to get temporary relief. Oh, and one more thing. Homework. They got to give you homework. They got to give you exercises, things you can do on your own to help you be more independent.
What are the most common frustrations you hear from patients before they come to Mint?
Oh, man. Common frustrations. If they are struggling I get a common one is, why didn't my doctor tell me about this sooner, right? Especially workers' comp, it can be tough because the doctors know that workers' comp cases, they sometimes won't approve additional care or treatment for a couple weeks, so it's not entirely up to them. It's the insurance that's dictating that. People will say that I was stuck or felt stuck doing a certain treatment for too long, whether that's a different PT, a chiropractor, pain management techniques, and they didn't get that personalized care. So then when they come here, they see something different. And I'm not trying to knock on anybody there. That's just there's bad physical therapists, bad chiropractors, bad medical doctors, and there's good ones in every profession too. So people just need to advocate for themselves.
What would you say to someone who says or feels like PT didn't work for them in the past?
I would say it's because they didn't see me. No, I'm just kidding. I think it depends. It depends on what the injury was and who did they go see. Were they in a clinic where they were treated mostly by some college kid? I mean, before PT school, I was a tech at a PT clinic, and I was more involved in care than I probably should have been. At the time, I was not aware of the laws and regulations. And a lot of clinics still run that way, having the therapist or the techs do care. So finding out, did they actually get care? Did they get physical therapy? Or sometimes they'll say, well, I watched some YouTube videos. I tried PT. I just watched a PT on YouTube. It's like, well, that wasn't special for you, right? It wasn't unique to you. But if they really, truly got physical therapy, well, it might be a different injury, right? So they didn't work for my back. Well, let's see how it goes for your shoulder. And sometimes additional cares are needed, right? The physical therapist they saw, did they do dry needling? Did they go and see a chiropractor and get adjustments? Do they need ozone or PRP, other more aggressive treatments? Because maybe what was provided wasn't enough.
Who is Mint not for?
Mint is specifically not for people who don't want one-on-one. And I'm not saying that sarcastically. There are people who want to be in a busy clinic. We've had 2 physical therapists who interviewed to work here, and when they found out that we only saw one patient an hour, they didn't want to work here because they want to work somewhere busy. We've had patients who want to be in a clinic where it's hopping and there's 10, 20 other people all working on stuff, and they don't want that one-on-one direction. They want to be on their own in a corner kind of doing their things. Come check on me, but just don't hover, right? If you want more direction one-on-one, then that's where Mint's good. But if you need more passive care or more on my own time, then there's other clinics we will refer you to.
What would you say success actually looks like for a Mint patient?
Ooh. Success for a Mint physical therapy patient would be reduced pain, one of the main things people look for, but more importantly, increased function. Can you do the things that you want to do? And then most importantly, longevity. So can I do what I want to do years from now? So if I want to be able to still go up and down the mountain, go hiking, or I still want to go hunting when I'm 85 years old, then I need to be able to do the right things building up to that. So if I'm going to pick up my 25-pound grandchild when I'm 80, then I need to be able to pick up 55 pounds now and have higher level of function now, setting us up to succeed when we're older.
What's a patient's story that perfectly represents what Mint is about?
Man, I even knew you were going to ask this one. Patient story represents what we're about. I've got a really good one. Sorry, I hadn't thought about this before. So working with this patient, she had headaches and migraines. She'd been everywhere. Okay, she's in and out of the ER all the time, because if you have migraines, you can go to the ER and they'll give you a cocktail of drugs to just stop the pain. But then the rebound migraine is excruciating. So she'd been doing that for years and trying to find answers. She'd tried acupuncture, she'd been to chiropractic care, she'd been everywhere, and nothing seemed to work. And her neighbor had gotten treatment from me and told her about what I did. By the way, they sold their house and used the money from that to pay for her medical care. Moved in with her in-laws, lived in the basement, because they spent all of their money trying to figure out this migraine thing. Anyway, working with me, second visit, we found that her first rib on her right shoulder was elevated. We got it back down where it should be, and all of her pain went away. She didn't have a migraine for a week. She hadn't been a day without a migraine prior to that. So why that stands out as different for me is if I had handed her off to a tech or had 4 other patients, it would have been a lot longer before I caught that, if I ever caught it. And because I had that one-on-one time with her, I was able to find exactly what was causing it. Then I came back the next time and I taught her husband how to help her with that rib issue in case it flared up again. And he was able to master that technique. And I haven't seen him in 2 years. Last time I talked to him, 0 migraines ever. And so she's spending all this money getting these medications when there was somebody just needed to take the time to fully assess her. How many PTs out there look at the first rib to see if it's elevated and affecting the brachial plexus or the scalenes and the other nerves that are shooting pain into the neck and head? One other patient that I didn't get to treat that illustrates this as well. She signed up with me, neighbor in the same area. This was out in Harriman. This patient signed up to work with me and then decided last minute to cancel because she wanted to use her insurance. And I was cash only. And I said, that's okay, but here's what you need to look for, because you're going to have a copay. And then if you haven't hit your deductible, you're going to get a bill for everything in the mail later. And you need to know this. A good company sets you up for this. They say, hey, here's what it costs bare minimum, but here's what it likely costs if you haven't hit your deductible, and they'll tell you. But not all of them do that. Well, she did 18 sessions, and where she chose to go, the other PT had multiple patients every time she was there. So she didn't get that one-on-one specialty care, 18 sessions. And then 6 months later, she texted me and told me I was wrong. And she said that she got a bill in the mail. I had told her it'd be $4,000 bill in the mail on top of her copays, which she had paid. And she texted me, you were wrong, it's $5,000. So I was wrong by undershooting it. But it was a $5,000 bill in the mail for 18 visits plus her copays. And I told her, I feel terrible for you, but did it help? She said maybe 5%. I was like, that is horrible. She just spent, 5 times as much as it would have cost her for her to see me, and maybe I could have done better, right? One-on-one, and I specialize in that. So unfortunately, one patient who I was able to help, another who ended up spending lots and lots of money and didn't get any help. And I asked her, still come in, let me help you. She said, if they can't help me, then why would you be able to? And that's the hard thing. If physical therapy didn't work for you at one place, that doesn't mean it won't work at another. physical therapy, chiropractic care, massage is like an art, right? If it doesn't work with somebody's technique or you don't vibe with them, find somebody else. I've had patients fire me because we weren't the right fit, and that's okay. I've never been offended by a single patient firing me, except one. And I know this wasn't one of your questions, but I'm going to tell this story anyway. This patient told me that she didn't want me to come back and work with her, and asked if a different PT from our group could go. And I said, that's totally fine. Can you tell me why? And she's like, well, because you made me move. That one offended me a little bit, because you should move. And if you're a physical therapist, you should be making people move. So that's okay though. We got her with another physical therapist, and I actually don't know how that ended. Hopefully it ended well.
What do people misunderstand most about pain, injury, or recovery?
Most people don't understand that pain and recovery are not they're correlated, but they're not linear, and they're not the same. So as your pain goes away doesn't mean you recovered, or as if you still have pain doesn't mean you're not recovering. So pain is just information. Pain tells you that there's a problem or a potential problem. And it's so important to understand that pain is just information. It could be wrong information. If you think about people with chronic regional pain syndrome and they have all this pain, sometimes there's nothing wrong. Sometimes the nerves are broken and sending the wrong information. Sometimes there's a chronic injury still there. Sometimes there's nothing. And so if we can get your pain down, you still need to make sure your injury is fully recovered. I've had people tell me, but I'll let me re-say this. So we assess them and find that they have an imbalance in their strength in their left hip. And they're like, yeah, but I don't have any pain. Like, well, it's going to come. You're going to get pain. It's coming. If you don't do something about it, right? This imbalance in strength is going to cause you to move differently and cause strain on your body and your tissues that over time will cause issues, right? You get bone on bone in your knee, often from knee valgus. Your knee is bending inward, putting too much pressure on one part of the knee and offloading the other part. So just if you don't have pain doesn't mean that you're not injured, or it doesn't mean you're not about to get injured. And if you do have pain, doesn't mean that you're injured. I know it's tricky, but take it as information, but get more information. And just as one example really quick before we move on to the next question, if you have a corticosteroid shot, so your knee's really bugging you, you get a corticosteroid shot, the pain goes away. Is the injury gone? No, you're still injured. The corticosteroid shot is designed to reduce inflammation, which can help with pain, and block pain, so you don't feel it for 3 or 4 months. One of the biggest mistakes people will make is they get this corticosteroid shot that causes damage, by the way. It causes damage to your cartilage and weakens your tissue, so don't do that too much, over and over and over and over. It's not good for you. Most of the time, obviously there's a couple examples where that might be okay, but that causes weakness in the tissue, and then you're pain-free. And then, why go to physical therapy? I feel great. And you just go back to life. And then 4 months later, it comes back. You're like, man, it came back with a vengeance. It didn't come back. It was there the whole time. You were just ignoring it. Is that an okay answer?
It's a great answer.
All right.
What's the bigger vision behind Mint beyond just treating injuries?
Mint has one big mission, and that's to create a company where all care is ethical first and foremost. If anything's unethical, all of the people who work at Mint know that it's their job to bring it up to Mint as quickly as possible. And if they're turned away, shut down, whatever, everybody has the contact information for the APTA. That's our board. Please go tell them if you don't feel like we're willing to change, but we are. We want to be ethical, and our patients can report it too. We want to be ethical. And then second, high quality care. We want that one-on-one time with patients. We want to get them better as fast as possible. There's two concepts. One, you make more money if patients get better slow, right? So they have to come to more visits. I'm not a fan of that. The other is you make more money, you're more successful when you help people get better as fast as possible, so that they tell everybody else. You got to go to Mint. It feels like family there. It's so fun to be there. And they answered my questions. I knew what was wrong and I got better fast. And then third is we want all of our therapists and employees in our company to grow personally and professionally. We want them to feel like they're becoming a better person and feel like they're enhancing their skills in their profession.
How do you want people to feel when they walk into Mint?
I want everybody to feel comfortable, feel at ease. Because it's when you're in pain, you're afraid, you don't know what the plan is. I've never been to physical therapy before. I'm only here because my doctor told me to. It can be scary. And I want people to feel at ease. Like as we're building more and more clinics, we're going to design them to feel like a living room when you walk in. So you're at home. And everybody there at the desk, anybody who works at Mint is going to be friendly and inviting, and then educate you on what the plan is and help you know what your options are. So that one of my favorite things is we tell every patient, you get to choose where you go for physical therapy. A lot of them don't know this, or they feel, or they'll get a call. Like if you get hurt at work, sometimes you'll get a call from some of these other companies and they'll lie to you. They'll tell you on the phone, if you go to Mint Physical Therapy or if you go to Mountain Land, your care won't be paid for. And that's a lie. You get to pick. You get to go wherever you want when you get hurt at work and take your workers' comp. We tell every patient that so that they know they don't have to be here if they don't like it here. I want people to know that they have that option so that they're choosing to be here if they're going to stay.
Final question. What does being in mint condition mean to you?
Being in mint condition, I think mint condition means being at your optimal game level in every aspect of your life. I love failure. I thrive in failure. And so don't be afraid to fail. Mint condition means that you're performing to the best of your abilities and striving for higher. So David Goggins talked about how people who aren't failing means that they're not trying hard enough. If I can do this perfectly, then I go here and I fail 5% of the time, or here I fail 20% of the time, then push it. Go here. Because as soon as you're perfect at something, that means you're not pushing it if you're not failing a little bit here and there.
Yeah, that's awesome. That's all we got.
All right. Well, thank you guys for joining for this episode. Hopefully it was fun to learn a little bit more about our company and our clinic that's behind this podcast. Brody does all the work to set this up and make this happen. He reaches out to different people in our community, or he has people reach out to him and try and set that up. If you're a chiropractor, physical therapist, MD, lawyer, if you're involved in healthcare, we would love to have you on the podcast so you can come and help educate society about what does it look like to be in mint condition, how to live healthier lives, and how to become independent in our own health. All right, we'll see you on the next one.